Hi there, I'm back. I told you I'd be back. It's been about 2 months and I literally have been recovering. And the doctor said it would take 2 months to recover from spinal cord surgery, at least for me, and he was right. So I thought I'd tell you the whole story. It was a meningioma, which is a fatty tumor, and they'd seen it about 8 years ago. And how did they find it? Because I was having um, problems in my chest and with growths with these things in my chest. So they were taking CT scans and MRIs, and they could see right through it, and they saw the meningioma right behind my chest, or mediastinum. And so they saw it, and they looked at it and they said, I don't think we need to worry, but we'll take another CT scan in about a year to see if it's growing. Well, they decided, or this one doctor decided, that it wasn't growing, so we just kind of ignored it. Well, 8 years later, 10 years later, my doctor said, you know what? It's growing. You need to see a neurosurgeon. Well, the word neurosurgeon really scares me. And so the word neurosurgeon really scares me, and spinal cord really scares me. So you get the two of them together, and I was terrified. So I went to see one doctor and one neurosurgeon, and she said, I think you need to have surgery on this, because she was afraid that it would, at this particular place in my spine, it would affect my legs, and I wouldn't have use of my legs. So that terrified me. And my first words were, no, I don't want to have any kind of surgery. I don't want a neurosurgeon. I don't want to have spinal cord surgery. I wanted to ignore it. But then my brain kicked in, and I realized that I needed to look further into this. So I went to another doctor, and he also said that the way the meningioma, or he wasn't sure what it was, he really left it wide open to be, he didn't know what, which was terrifying also. So you add that onto it. So I went to see another neurosurgeon that was recommended to me at City of Hope. And that surgeon looked at my records, looked at my CT scans, looked at my MRIs, and he showed me what he saw. This tumor, whatever it was taking over my entire spinal cord. And he also was afraid that I would wind up not having use of my legs. And plus, he said it could grow a little bit more, a tiny bit more, and who knows what nerve it would affect. When I saw it, I realized that they knew what they were talking about. And made an appointment. Well, I didn't make an appointment for the surgery. I really thought about it. I had another appointment with the doctor, and we discussed it, and he was really pushing for surgery. And I was really holding back. Not, why have surgery if you don't have any symptoms? But as the doctor explained, get the surgery before the symptoms, so it's easier the surgery is easier to remove it before you have symptoms, as opposed to having symptoms and wanting to be symptom free. So I made an appointment for the surgery. At first it was for a couple more months, or 3 or 4 months. And then I became so anxious. I mean, really, really anxious. Forget anxious. I was scared. I was really, really scared. And it kind of took over my whole life. I was that scared. And my husband was scared. And my kids were scared. We all were scared. And this was right in the middle of when the pandemic, when COVID, this past Christmas, we were all terrified. And suddenly I thought, I've had it. I want just get the surgery over with. And we changed everything around and had the surgery 2 months early. But thank goodness I had it. I went to City of Hope, and one of the reasons I went to City of Hope, well, first of all, I have enormous trust in them and respect for them, and it's a great place. But also that my primary doctor said they deal with tumors all the time. And so she suggested that I go to City of Hope. At the same time, in meeting with my doctor, Mike Chen, over at City of Hope, I really liked him. I liked his attitude. I liked him as a doctor and as a human being. And you remember I went to City of Hope for radiation treatments, and how impressed I was with everybody there. And so I was really happy to be able to go to City of Hope and grateful. Oh, the first thing they do is you have a lot of what do they call it? Pre-operative analyzation. They just ask you so many questions, and they want to know everything about you and everything medically about you. And meanwhile, what you need to know, what everybody needs to know, I was walking. Now, if you were on Instagram, I was taking you on my walks all the way. I live up in the hills, and one of the ways I exercise is by walking up these streets and, working up these hills. And I walk upstairs the place where I get my hair done is on the 3rd floor. So I walk up the 3 flights of stairs. So what I was doing was I was preparing myself for surgery, which I highly recommend, by walking up these hills and, working hard, going up to the highest place, coming down. But I was really preparing my heart for surgery, which, I really recommend. If you're going to have surgery, get yourself in shape. If you have a few months, prepare yourself, be it with food, be it with exercise, whatever you can do. So where do I go? So I went for, pre-op, and they test you so thoroughly. It's very impressive. And then I went for surgery. It was around 7:30 in the morning. And I'd already decided, deep breath, I'd already decided in my mind I was going to be okay. I told myself, you're going to be okay. And I pictured myself walking, dancing, hiking. I pictured myself in a positive way. I wanted to be as positive as I could. So they did the surgery. It was about, I'm not sure, it was about 3 or 4 hours long. It turns out that it was a meningioma. It wasn't cancer. It wasn't another kind of tumor. It was a meningioma, which, as I say, is kind of a fatty tumor. And the doctor said, this is interesting. So when you have a tumor in your spinal cord, what they do is they have to cut above the tumor. I don't know if they cut below, so that they can go in and remove it. And they have to drain all the fluid out of your spinal cord, which is one of the reasons I was in intensive care for so long, so that the fluid would go back into my spinal cord. But as he described it, they go in they cut down your back, and they spread your muscles away from the spinal cord, and then they go in and very minutely take each piece of the tumor out, one at a time. And that's why it takes so long. So, but he said that mine was really easy to get out. It was like peeling an onion. He could peel it out. And so he was able to peel it out in, I think, 3 or 4 hours. And then the next thing I knew, I woke up in in intensive care. No, probably in post-op. And then I went to intensive care. I was fortunate. My family was there, my husband and my daughter and son, and they all told me that everything was fine. And I'm sure I went to sleep. I'm not sure. I can't remember. But I was uncomfortable after all of the anesthetic wears off, but they keep you well sedated. So I had opioids, and I had opioids, and I also had what are they called? Gabapentin, which takes care of nerve pain. And so I had gabapentin, opioids, and everything, and it was all intravenous, taken care of. and I was really out of it. I know that the first night my daughter spent with me, and she made sure that I had all the medication necessary. So she took very good care of me. And then, um, let's see, what happened after that? So I was in intensive care for I think 3 or 4 days, and then I was in a regular room. Oh, it was funny. They have fabulous food at City of Hope, but all I could eat for at least a few days was, I loved having pancakes, but there were some days that I couldn't even eat. So it was I was just, to be honest, I was just out of it. And I didn't watch TV, I didn't read, I didn't look at my iPhone. I really, I think I just rested. Um, as I say, the pain, it was, it's not something that I remember as being terrible, but I think that's because they just gave me the right medication. Doctors would come in all the time. Um, Finally, I think after 3 or 4 days, they had me walking, and I was doing pretty well. They just wanted me to walk. They didn't. They had to. You had to stay in intensive care until the fluid got back into your spine, and so you had to wait until it was the right time. And then I went walking, because they want you walking so that you don't, if you lie in bed too much, you can get pneumonia. So they wanted me walking, and I walked just fine. It wasn't a problem. Um, you know, I was I was thrilled, and they were also. In fact, I had no problems with physical, well, I don't know if it was physical therapy, but they had me walking in the halls, and they had me there when let's see, oh, they had me when I graduated into a regular room. There were some steps that I could climb, and I didn't have a problem. And I think, and the doctors think, it's all because of my walking these hills. So when the doctors tell you to do things like exercise and eat well, I think we need to listen to them, because it really worked. And I remember when I was walking, I remembered thinking, I need to tell all of my Instagram followers that they need to up their health game, because it's going to make a real difference. They're not just saying it, but my walking really helped me get better so much quicker. So I was in the hospital, let's see, about a week, and then I went to rehab. And my doctor really wanted me to go to rehab. I think he saw, here's an 82-year-old woman. She's just had major spinal surgery. We need to make sure that she's okay walking. So I went to rehab, and they had me doing all sorts of stuff. They wanted to see what my balance was. I was walking up and down stairs. I was walking down the hallways, and the hallways have like bars, so that if you need to grab onto something, there's a bar right there where you can grab onto. Let's see, what did they have me do? They had me I was walking on the stairs to each floor. I was walking, I was balancing, I was doing everything I was in rehab for about 3 days, and I was doing so well that I said, I think I can leave. And I was able to leave after 3 days in rehab. And what they taught me there is bacon, lettuce, and tomatoes. So it's no bending, no lifting, and no twisting. So I always had that in my mind, BLT. What am I supposed to not do? What am I not supposed to do? So when I got home, needless to say, they teach you how to get into bed, how to roll into bed, how to move. That was, I think, one of the main things they teach you is how to move. They showed me how to shower. They showed me how to, let's see, what are the things I did? How to work in the kitchen. And my husband was enormously helpful. And I was really, really a good patient, and paid attention and was really very careful. I must say, if I'd sit up for too long, and working on my computer, my back would kill me. So I would go into my bedroom and just lie down across the bed and have my iPhone, and I'd flick through it, And before you knew it, I was fast asleep. So I did a lot of sleeping, a lot of resting, a lot of, I'd say that's what I did a lot. I'd spend most afternoons on my, and I think, you know what really works? It's not lying on your back, it's not lying on your stomach, but lying on my side was I guess it took some of the pressure off my back. So I laid on the back, laid on the bed on my side, flicking through my iPhone and sleeping a lot. I didn't even know that I was falling asleep. Didn't even do reading. It's interesting when you're recuperating what works, and it's kind of keeping things simple, which is not reading, but being entertained by my iPhone. Um, I would watch, what was I watching? There's a wonderful, charming lady from the South called Brenda Gant, and she's a Southern lady who cooks in a Southern way, and I had the best time watching her on YouTube. And I also was watching dogs being trained. I don't have a dog, but it was just interesting and just took me away, and I'd watch dogs being trained. The other thing I did was I had physical therapy at home. And the wonderful thing was the physical therapist knew that I loved hiking. And so she said, we want to get you back to what you were before you had the surgery. So we went walking. Well, the first time we did exercises. That's what I called pole dancing, because I held on to a pole. Well, it isn't a pole, it's a pillar in my house, and I do exercises with my legs. And then I think it was after a week or so, we then started walking outside, and we walked out with, have you heard of an oximeter? An oximeter, it tells you how much oxygen in your blood, and you're supposed to be in the 90s. So she would test my heart rate, and my how much oxygen I had in my fingers. And the first time we went walking, I couldn't walk very far because I got out of breath, and the oximeter went too low. So we just went a little bit. But then even walking up my hill to my house is really hard work. So that was the first time we went walking for physical therapy. And then the next time we went a little further and a little further the next time, till I was able to make it to the top of my hill up here. So then I knew that I was really getting better. But the other thing that I saw that I was getting better, don't rush it. It's so interesting. When you're ready, you'll know it. I just wasn't thinking clearly. My mind didn't say that I could do this. Your mind, your body and your mind tells you, okay, Sandy, you can do a YouTube, you can do Instagram Live. It was, you feel it in your brain and in your body that you can sit up longer, you can talk, you can speak longer, and your energy, you've got the energy to do it. I knew this when I could get things done that I'd been putting off and that I wasn't doing. But when I was able to do it, it wasn't errands, it was telephone calls, it was arranging things. When I could do that, I suddenly thought, whoa, I've done a lot today. Well, it wasn't a lot, it was 3 telephone calls that I've been putting off, but I could do it. So I knew that I was getting ready. And that's how I knew that I could start back on YouTube. I must tell you, one day, my physical therapist and I went walking, to the end of the street. So maybe it was a quarter of a mile. So it wasn't very much, but I thought, oh my goodness, I'm doing so well. So I told my husband, let's go. What did I want to do? I wanted to go to Sephora, of course, because I wanted to get some items that I'd been watching on YouTube. So I wanted to go to Sephora, and I knew I had to go to the market. So we went to Century City, and I walked to Sephora, which is quite a walk. And then I went to the market, and my husband needed to get a watch, you needed to get a battery. And then I got home. I couldn't believe how exhausted I was. So in fact, we did that on a Friday. Saturday and Sunday, I couldn't move. I was flat on my back. Not on my back, I was on my side. I was so wiped out. So I learned that, you listen to your body. I didn't know that I could be that tired. I was so tired. I was wiped out. And then, oh, you'll get a kick out of this. Talk about, I was angry because I was eating, but I was feeling so acidy. I was feeling nauseous. I couldn't eat. I felt, when you feel just yucky, I guess you would call it GERD. So I got angry and I stopped taking all my medications, all of them. And I know I know. But it shows you I wasn't thinking straight. And so I called up City of Hope. They've got a wonderful way of being able to reach the nurses and triage. You can reach people in the support center. And I called them up and I said, my stomach isn't feeling good. And so I stopped taking all of my medications. And they all said, and when I stopped taking all my medications, I was in so much pain. I mean, I was crazy. So when I spoke to them, they laughed. They said, "You did what?" And I said, "I got angry, so I stopped taking all my medications and I really hurt." And they said, "Don't ever do that again, please." So I've learned my lesson. I won't ever do that again. I went back on my medications and I felt so much better. I called my internist and got medication for the acid I was feeling. I felt so much, well, that took about 2 weeks to really kick in. But so I've done a lot of silly, stupid things, but I recovered from them. So I'm taking my proper medications. I'm not overdoing things. I'm doing things in a, what would you call it, in a more measured way. But I suddenly knew I was ready to do YouTube. I've been doing some Instagram lives, and in fact, I'd like to do some YouTube lives. I haven't done them before, don't know how to do it, but I'm going to do them. So I'll announce them on, is it the communications tab, something like that. And I'd like to do some lives. Let me know if you'd like to watch some lives. And maybe you can ask questions and I can answer. But anyway, so the recovery went well. With a few, when I had pain, I was sent home with all the proper medications. If I had a problem, I called the doctors if they needed to. I didn't speak to the doctors, I spoke to the nurses, and the nurses were if they didn't know the answer, they spoke to the doctors. So I'm back, I'm walking, I can walk to the top of the hill. Do I have pain? Yes, a little, some, but it's not, I can take care of it, even with Tylenol. And it's nice to be back again. And I've been trying some fun products, and I'll let you know about that. And it's nice to be back again. It's nice to see you all. And hope you're all doing well. And I'm on the way to recovery. While I was in rehab, they showed me, well, first of all, they showed me how to take a bath or take a shower. And fortunately, my husband had installed a handrail in our shower, so that I must say that when I would take a shower at home, I was always holding on to the handrail because I didn't trust myself. But I also bought this little goodie, and so that I can, you see, I wasn't allowed to bend, so I could wash my legs and I didn't touch my back because I was afraid of hurting the incision, but I can wash my feet and the lower part of my legs with this thing. I'll put it on my Amazon store. So this works well. And then the other thing, this is, remember, I'm not allowed to bend, and so this is a shoehorn, and this way I don't have to bend to put my shoes on. So I use this this is what they gave me to put my shoes on with, which I use. And then I love this gadget. This, you know what? This can pick up a penny. It is so good. So again, so that I can reach things, be they high or, you know, low. So these are some of the gadgets they give you so that you can not bend, lift, or twist. And I use them, and I keep, well, actually, I got a couple of them. I have one in the bedroom and one in the kitchen, and that's where I mainly are. That's where I mainly am. And so I have all except the shoehorn. One's in the shower, one's by where I get dressed, and this is in both places. And what I'm amazed at, it's really fun that I can pick up. I like sometimes I'll drop a pill, and I'll be darned because it's got rubber tips. I can even pick up a pill, so I get a kick out of that. So these are all devices to help we people with back surgery and spinal surgery help us manipulate the world. Oh, and of course I just remember to tap on the subscribe button and to tap on the like button and the, what else? And the bell. You know what? I've been off YouTube for so long, I've forgotten what I'm even supposed to say. And subscribe, yes. I'll see you soon. Next week. Bye-bye.